Knock it out. All right, we're just going to start with the weekly numbers. Doing great. Heck of a
Crushing
job.
it.
2,303 deaths this past week. I mean, this is, as Derek Franks, I'm sure many of you follow, it is the 6th straight week with more than 2,000 deaths and 22nd straight week with more than 1,000 deaths.
I think the important part is that, look, the CDC, I mean, not the CDC, but Fauci said when we get under 10,000 deaths, and at some points he said like 4,000, I'm sorry,
No,
infections.
cases.
4,000 cases a day, we're in a better place. And we were at a million. And
we're still at
the
a million.
important part is that it wasn't just that was a spike. It's that in this next wave, the plateau is higher than it ever was. So when we come down from COVID and
our valleys are,
COVID, the valley for COVID is higher than it ever was. So like we are not closer to doing anything
like
about
excess deaths. Yeah. Like we just keep only talking about excess deaths based on 2020 forward. So, well, since then, it's very high. So when it dips, we're like, oh, excess deaths are down, but we're still way above where we were in 2019, right? The mass spread of COVID is, and this is also Derek Franks, but these stats were pretty staggering. On May 29th, 2021, the U.S. reached the all-time low of COVID transmission. Wastewater levels were at 40 copies per milliliter. On July 17th, 2021, levels went up to 121 copies, and it never went below 100 again, as Pat was saying. Today, we are at 883 copies. That is how badly we are letting it spread. At the same time, the CDC says 1-day isolation when you test positive for COVID. And how would you know? Because nobody tests anymore, because there are no tests. You can't get PCR tests. The rapid tests are expensive. They're not very accurate. People are sticking it in their poo because it's not accurate with their nose and we're just going to let it rip.
Everyone's just ignoring it. And we've accepted the new norm of higher than ever. And, the excess death thing, just to sort of simplify that for people, they're saying excess deaths are down, but they compare that to the peak of the pandemic. So
before vaccines and everything,
our normal shouldn't be there. And that coincides with when they're basically killing all the reporting mechanisms to say this person has COVID, died of COVID related, because they want the world to think, okay, the acute phase of COVID, when you get it initially, you survived it. That's what matters. That's it. It's not doing any long-term damage to you. It's not that big a deal. Get to work. And look, to get rid of a 5-day isolation for anything, any disease, is stupid. You should isolate if you get the flu for 5 days, and this is a level 3 pathogen that before COVID, you had to wear a fucking hazmat suit and take all these precautions to be around it. Now they're like, well, you don't have to wear a mask even in a hospital.
And when they study it, they're like hazmat suited, right? I mean, it is the number one infectious disease killer in the world. The second one is TB. And, when you have TB, there are protocols in place: testing, isolation, reporting it to the people who can then monitor, make sure that you're taking your pill, like all of those things. They take it seriously. And this, we're just letting it rip. And they even said, and I don't even know where it is anymore, but anyway, the CDC said, listen, we're just trying to meet people where they are. It's the one time they ever do. We just didn't think people would be staying home, but mostly, so many people are sick now. It would just mean that nobody would be coming to work. Well,
right. It's all about the economy. And when they say meet people where they are, it's the same thing with masking. Well, your job as the CDC is to inform people of the risk. And we've shown over and over again that if people are actually informed of the risk involved, they say, oh, I would like to wear a mask if I knew it was a dangerous time right now to wear it, to be around COVID. Well, it is a dangerous time. It has never really stopped being a dangerous time to be around it. But we normalize the fuck out of just getting it. And it's because they've managed to convince people, like I said, it's an acute disease. They think it's just, if people knew that it's wrecking your immune system and causing the TB to rise, all these old diseases are coming back into play. It's cancerous. It's going to cause cancer rates to spike. And none of that's, it's going to take 10 years for any scientist to really ring the bell like, holy fuck, it caused a massive increase in death, but nobody right now is willing to, I mean, there are doctors out there doing it, but nobody in the government is getting anywhere near admission of all this stuff. And I love Bernie. I used to, at least, but fuck him for being the chief person who could have done something about this. He could have raised so many alarm bells for people on this issue in his place, his position, the top Senate.
Just like calling for a ceasefire, which he hasn't explicitly done. He waits until, a million people are gone. Cora, I see that. And yeah, I think you're right. Got exposed to TB at work and watched a grown man cry. Minimizing TB and measles absolutely will be next. They are just going to, already people aren't getting vaccines, like regular preventable childhood diseases. They are just deciding that vaccines are too scary because, the Koch brothers or the Koch and Brownstone Institute have done their damage there. And, now they're saying, oh, maybe HIV AIDS isn't real. It's this whole very strange right-wing idea of take supplements and get some vitamin D. It's just I don't know.
It's a mess. And I mean, honestly, I'm very happy about one thing recently. I'm very happy that RFK Jr. is so pro-Israel. Because otherwise, that guy could have a chance of winning the election. And let me tell you, he has done more to set back this country as far as vaccines and believing in science than anyone out there.
I mean, okay, you know what? You say that. I mean, I think it's despicable. And he's awful on the border. He's awful on Israel. I mean, he's just a mess. But again, almost like Trump, Biden has done so much to kill the believe science crowd. So I wonder if you have somebody who's as wrong on so much of the science as RFK Jr. is, that liberals would sort of call him out more and there'd be more of a dialogue. But maybe you're right. Maybe MAGA will just go with him and then nobody. I mean, I don't know. We're such a mess right now. I'm
just happy to see his career end on this Israel thing because he's so wrong on that. He's turned so many people off. But the destruction he could cause to our public health. Yeah. Could it be worse than what Biden has done? I don't know. I'm not saying it could be. It could be the same, but I don't think anyone deserves that position. Just like saying Trump's just as bad on Israel. Well, that's no reason to give your vote to a guy who's actually actively funding the genocide.
Right.
So, I mean, I just hope that
I don't know. I mean,
I could sucks.
Yeah. I mean, he does, but does he? I mean, I could see people who are trying to either send a signal or just want it to be different. I don't know. You might be right.
Well, that's where his sport comes from. But those people, for a lot of those people, I think even if you minimize COVID and that was your reason for supporting him, you can't overlook how he's been more pro-Israel than even Biden.
Yeah.
He's
vocally.
He's like an actual Israeli citizen who's like, Bibi isn't going far enough. That's pretty much RFK's position on Palestine and Israel.
Yeah, he's awful. Okay, two more really quick things. We thought this was a sort of funny. I would punch a Nazi, which that's like the big left thing to say. My brother in Christ, you won't even wear a mask. Which, it has really just been so disappointing to see so many on the left swallow the Kool-Aid and get in line for the Capitol class and push everybody back to work and just say it's like a cold. Last week when we were talking with Julia and she was saying, watch how people treat the disabled community because that's where it always begins. And, there was this article that the 1918 flu pandemic boosted support for the Nazis, the Fed study claims. And I do think, what happens is and it started, it's like, at first it was like the pandemic of the unvaccinated, which was an appalling thing to say, knowing that so many of the people who weren't getting vaccinated were in poor communities, in Black communities where they did not have healthcare, they didn't have clinics even, they had a reason to be nervous about a vaccine, not trusting that it would actually be free. Many times people would show up for the free vaccine, they were still charged, oh, where's your insurance? There were a lot. So, but that was a way of all of a sudden saying there's some people who do deserve to die. And then it became, oh, it's, well, people who are already immunocompromised or have comorbidities, right. So much for them. It's just older people, there were we just became very glib and blithe about the whole swaths of our population that it's okay if they die, they're too heavy,
And look, we're flat out there at this point. I mean, I think we are. It's nobody's going to change their life no one's going to change their habits to save disabled people. They're just like, well, I have to live my life. Okay.
Yeah.
If that's your outlook, I mean, that's a pretty shitty outlook as a progressive. You should protect the most vulnerable. That should be core to your belief system as a progressive. But the fallacy is that even that is like, okay, that ignores all the damage it actually is doing to you just because you survived COVID. Like, you don't know your own personal risks. Like, I mean, like I said last week, 2 people in my family died of heart attacks, like in the last, within 3-4 days of each other, it's COVID is doing all this damage to people that isn't attributed to COVID right now, because our government and media are doing all they can to prevent that connection from being established.
Yep.